Major news on the battle against the coronavirus. Starting tomorrow, children ages 6 months to 5 years old are eligible for a COVID vaccine. It's a milestone that many families have waited months for. The CDC is also endorsing the move, encouraging families with kids ages 6 months to 5 years to now get them vaccinated. We know there are likely questions out there from Idaho families about these vaccines for kids. Our Joe Paris spoke with medical and COVID expert Dr. David Pate, a member of the governor's COVID task force. So, Joe, what's Dr. Pate's reaction to the vaccine approval, first of all?
Well, Dr. Pate and the medical community, Doug, it's very welcome news, and the news that the medical community has been waiting for months, and you could argue years. Now, both Pfizer and Moderna's vaccines are now authorized starting tomorrow for anyone aged 6 months and older. And Pfizer's vaccine had previously been authorized for people ages 5 and older, while Moderna's vaccine was previously authorized for people 18 and older. So with the expansion now, 20 million more people, kids, are able to get that COVID vaccine. With that said, we are almost 2.5 years into this entire pandemic, and that creates questions for parents and families about what decision they should make for their child. The general advice is to get your kids vaccinated against COVID. Experts know that there are still many questions from parents, though. Some high-level questions, some more general ones, like, how will my child react? I know there's a comment out there in the community from some parents that say, you know, my child who's age 6 months to 5, they've gone through this whole pandemic without any issues. Yeah, the shot's available now, but do they really need it at this point? How would you answer that question?
What I would say is I just look at what's happening. While I would have agreed last year that if somebody had infection, they probably had a fair amount of immunity or protection for a period of time, what we're seeing now is you're getting very little effect on the immune response from an Omicron infection. And that goes back to the beginning of January of this year. So what your concepts about protection from prior infection, throw that out the door now. We're different. We know this is a safe vaccine. We know this is well tolerated. What happens with this vaccine is if your child has previously had COVID, they'll typically have their more significant effects like the adults did, sore arm, feeling bad, fever, those headache, those kind of things with the first shot. If they have not had COVID, then they're more likely to have those bigger symptoms with the second shot.
The other factor for getting your child vaccinated is the community's battle against COVID. Getting your child vaccinated can really help the community at large, especially those vulnerable populations. Here's how.
If we want to decrease the number of mutations and the number of variants that occur, we have to decrease transmission. Variants are not related to what the mortality is. It's related just to transmission. And kids are an important part of transmission. So if we want to stop those new variants, we have to decrease the transmission. And I don't know that a future variant isn't going to be more of a serious issue. People that say that these viruses inevitably evolve to be milder, they are mistaken. I could give you many examples where that does not happen.
Just to answer some questions that are out there for those of you that are wondering, the vaccine doses for children are not the same as those for adults. They are scaled for children, just in case you were wondering. But again, the big news going forward, starting tomorrow, children aged 6 months to 5 years, they are eligible for a COVID vaccine. And Doug, the big advice right now from people like Dr. Pate, experts in the medical community, if you do have concerns about getting your child vaccinated, talk to your primary care physician. It's very likely they're going to tell you that vaccination is right for your kid, but that's why if you have issues, you need to talk on an individual level because only your physician can tell you what's best for you and your family.
And Joe, when you say scaled for a child, basically what you're saying is that there's a full adult dose, and then for children, because they're so much smaller, it might be quite a smaller percentage of that same size.
Yeah, there's a different measurement and there's a little bit of a dosage rollout for children, and your primary care physician can explain that. But I know we saw some comments online today, Doug, people worried, well, if they're just going to get the same shot as adults, how is that going to affect their body? We can report to you, we can tell you for sure that the doses are scaled appropriately for the size of children's bodies.
All right, Joe, thank you very much. I know we have more on this today on the 208 and the news at 6.